Good evening, everybody. Let us start with the session. To everyone from the Divine School of Homeopathy, a warm welcome to all of you. I think there are many more participants who are there in today's session, and I'm quite sure you'll learn a lot in this next 30 minutes. I'm going to share one of the important topic, which is very, very essential to because it is quite difficult many a times. And that's why I have considered this topic for today's session. Homeopathy in acute and chronic pancreatitis. Why it is so important? What is the problem? First important thing, Hahnemann explained that you must know the disease before treating that disease. You must have knowledge of disease. And if you go through the pancreatitis, there are two varieties, the acute and chronic pancreatitis. If you go in understanding the pancreatitis, then you will understand the mortality rate is quite high in pancreatitis, basically in chronic pancreatitis. 1 in 10 patients, there is a mortality. So this is too severe. And that's why it's too important to know how to treat these disorders, which are generally found to be difficult from the modern point of view. And we have ample remedies. Even though we have ample remedies, it is quite difficult for us to treat because no one dares to treat. This is too important. Acute pancreatitis, sometimes it is self-remitting. Many times it disappears by its own. Sometimes after even allopathic treatment, it settles and patient settles all. But chronic pancreatitis is quite difficult. There are many reasons, many causes behind those pancreatitis. Generally, faulty diet is the most important factor which can lead to the pancreatitis. Chronic acid peptic trouble sometimes induces the pancreatitis. But most common reason behind the pancreatitis is always an alcoholism. And chronic alcoholics always suffers from this chronic pancreatitis very often. But many times I have observed that even in children you get this pancreatitis. And then what is the reason? Alcohol, yes, it has been said that this is the most common reason of pancreatitis. But in children, if it is there, how can it be in children? There is no consumption of alcohol, still it happens to be there. And then when you find it out, the things, you find it out, the diet, which is very, very faulty nowadays, diet consisting of more and more fats, the fried diet is the most common reason behind the pancreatitis, and which you can get in children nowadays very often. The junk food is the most important cause of the pancreatitis even in children. And this pancreatitis you can diagnose with the help of laboratory investigation. Lipase is one of the important investigation which denotes you directly a consideration of pancreatitis. So liver enzymes, the pancreatic enzymes, these are most essential entities which you have to understand. And accordingly, you diagnose. Ultrasonography defines that. The commonest presentation is always pain in epigastric region, more commonly with a severe discomfort, with vomiting, many a times bilious vomiting. Many a times this vomiting is associated with the nausea, lot of flatulence over there in the abdomen. And in acute pancreatitis, there is a very severe acute pain is also one of the important factors. Total loss of appetite, loss of flesh, these are common things which you can get in pancreatitis. USG guides you. Sometimes there might be a calculi over there in the lower end of bile duct and can induce the pancreatitis associated. Sometimes you have to go for CT scan, sometimes even MRI also. These are the investigations which diagnose the thing, but basically it is the pancreatic enzymes which you have to do and rule out the pancreatitis. So I will going to share two cases where I have successfully treated. Both of them are chronic, but one of them I have treated an acute episode of a chronic. And that's why both things denotes how to approach towards the patient. So one must go ahead with how to understand. We must learn the logic, anything else other than anything else. So we'll go ahead with this. First is the case number one. So it was a very interesting case. A 11-year girl was brought to me on 21st September 2014 for the treatment of chronic recurrent pancreatitis, a daughter of a urologist. She was admitted in the hospital for the same a week before at Nasi. This was the fourth time when she has to admit for acute pain in abdomen with very severe yellow sour vomiting. She had sour eructations along with heartburn and loud belching. Pain in abdomen was crampy and aggravated by pressure on abdomen. She used to feel better by lying on side. The USG done every time shows pancreatitis with enlarged mesenteric lymph node. That was another important feature which was there. Patient's mother narrated a very useful hint that every time attack occurred on full moon and after taking the meal. Similar attacks occurred around every 2 to 3 months interval, and every time she was admitted. This was the case basically. And what happens when a urologist comes along with the daughter over there, they talk in the terminologies of the modern medicine. He said that lipase.
Hello.
Hello, hello. He said that
हॅलो सर आवाज येत नाहीये.
आवाज येत नाही. आता
येते येते
येतोय आवाज. Okay. So he said that lipase is so high and she used to have the problem and all those things. This is what he has explained. This was the problem with the when you deal with the allopaths, they always talk in their own terminology, and which is not important from our point of view because our prescription never depends upon it. He talked in terminologies of we have done the scan and that also shows the suggest the pancreatitis, and I'm in lot of frustration being an urologist. I could not help her. I could not prevent the recurrence. And this is fourth time consecutively she was admitted. And every time it is so severe that we have to admit, there is no option. So this was the condition with the patient. So you have to understand all those things and then you have to go ahead. So this is chronic pancreatitis. This was further history. There was much frustration on the part of the father, being a urologist. He cannot help to prevent the recurrence. The past history was very clear. There was craving for pencils and mud in the childhood. There was history of recurrent URTI and LRTI with cervical lymphadenopathy in early childhood, treated with allopathy. Family history, the hypertension and diabetes at the paternal grandfather as well as maternal grandmother. Both sides, this diabetes and hypertension was there. So this was the sufficient history which I got, with which I have to approach. So when you think about such a thing, you have to find it out what else is there. So basically, in such types of cases, you have to ask about the nature of the person, how she is. So that nature guides you a lot. So personal history, there was craving for eggs, there was constipation tendency with hard stools followed by soft, but passes with difficulty, disturbing sleep due to the horrible thoughts in the mind. And her mother narrated a mental state. Doctor, she is quite obstinate, lazy child. She reacts very slowly to the orders. I have to insist a lot to her for everything. She wakes very late in the morning. I have to push her for everything as her school bus comes at 9 a.m. She never keeps things in proper place, but she likes to wear dresses which are exclusive. She wants every school material as exclusive, like pens, the compass, even her dress material. She gets exhausted very easily, very early. So if she runs for a little bit distance, she gets frustrated. She gets very much exhausted, frustrated. General examination, 50 kg was wet at the age of 11 years, quite obese. Menarche 4 months back, very early menarche. Pulse was 95 per minute. So it is again a little bit tachycardia was there. And it was because just 8 days back, she had an attack of acute pancreatitis, acute spasm. Systemic examination I have done. There was tenderness in epigastrium as well as umbilical area. And this was the case. So here, I know you know the remedy. Remedy is very clear. How to deal with that is more important. The remedy is very clear. How to handle this case and how to tell them properly what to eat and what not to eat. What are the things which can prevent the relapse? Basically, whenever pancreatitis is there, you have to ask the patient to take the rest. And not only rest itself, but give the rest to the pancreas. That is more important. So how will you give rest to the pancreas? Ask the patient to avoid the fatty food. Ask the patient to avoid the junk food. Ask the patient to avoid the chocolates where the fat content along with carbohydrates is much more. The things which are containing more fats should be avoided. And this is too important. So this was the case. And as Dr. Anita, she has rightly explained, Kalki because picture clears Kalki. But generally, I never prescribe immediately unless and until I repertorize. So I repertorized the case. And yes, it was Kalki. I considered some rubrics, and those rubrics are very important. I have considered even a pathological rubric, inflammation pancreas gulls in. Very important rubric. Inflammation pancreas gulls in. Calcaria was there, pulsatilla was there. Second important rubric in her case was exclusive too. The third one, obstinate, headstrong children, slowness, indolence, inflammation, lymphatic tissue mesentery. That was another pathological rubric, but it was clear-cut evidence. Food and drink, X desire, milk product aggravates. That was her condition. It has started from the milk. Generally, it is moon aggravates food. Stools, hard first stopped then. Precocity, that was another early menses in her case, precocity. And last, obesity in young people, children, girls. So these were the rubrics, and through, I got the calcaria. So I considered what is the role of calcaria in pancreatitis. Because when we prescribe calcaria, we generally think about the mental picture as well as the physical structure. But at a particular level, is there anything very specifically mentioned about it? And that's why I used to use the boric and allen, they are God for me in practice. I used to refer them again and again, again and again, again and again. This is my habit. So I have put the boric medica and let us see what he has mentioned. This is great Hahnemannian antisoric, the constitutional remedy par excellence. Its chief action is centered in the vegetative sphere, impaired nutrition being the keynote of its action, the glands, skin, and bones being instrumental in the changes wrought, increased local and general perspiration, the swelling of glands, very importantly, swelling of glands, scrofulous and rachitic conditions generally offer numerous opportunities for the exhibition of calcaria incipient cases. So this was the picture, very clear cut, and main specifically antisoric remedy where glandular enlargement is there. Pancreatic gland, very important, very specific. Persons of a scrofulous type. Scrofulous means where the glands are affected, who takes cold easily, with increased mucous secretions. Children who grow fat are large bellied with large head, pale skin, chalky look, and so-called leukophlegmatic temper. Children crave eggs and eat dirt and other indigestible things, are prone to diarrhea. Calcarea patient is fat, fair, flabby, and perspiring cold and damp. Everyone knows this picture. Modalities, two important modalities which were there in this case were the worst from exertion, mental as physical, as well as aggravation during the full moon, which was very, very specific for this case. So I have started the case with this. At the stomach level, you find it out the symptoms very clear. Milk disagrees, craving for indigestible things, colds, chocolates, chalks, pencils, eggs, specifically sour vomiting, dislikes fats, heartburn and loud belching, cramps in stomach, work by pressure, cold water, ravenous hunger, pain in the epigastric region to touch, abdomen again. There is a direct symptom that inguinal and mesenteric glands are swollen and painful. It is given in the abdomen. So the Calcarea cup covers the whole story. It is also a good remedy for gallstone coli, increase in fat in abdomen. These all the things which goes in favor of this case. So naturally the selection is at Calcarea cup. Only thing is that regarding the potency. So on the 21st September, auxiliary measure, avoid bakery products, Chinese food, junk food, all those things, fatty food, I asked. And second important thing, at the same time, I asked them to reduce the weight reduction diet. That I will share what I have asked. Medicine Calcarea carb, LM, daily 1 dose, empty stomach. That's all. Daily 1 dose. For 1 month, I have prescribed because patient was from Nasi. So this is the diet chart. Generally, I used to prescribe when one has to reduce the weight. These are the things which one should avoid. Oil, ghee, small grains, poha, potato, sweets, non-veg food, all foods, milk and milk products, rice, groundnuts, tea. Please don't apply the oil and ghee to the roti. While sleeping, lie on left side. Avoid the tobacco products. These are the diet charts and few important things. Please divide your food only into parts if you want to reduce the weight. Full lunch early in the morning and full dinner evening. Nothing in between. No breakfast, tea, coffee, biscuits, etc. in between. If you feel too hungry, take the sprouts. And this is the diet which I used to advise when I had to reduce the weight. Plenty of water in sips between lunch and dinner. Please avoid drinking the water during lunch and dinner. Common exercises one can do. Go for a walk in Surya Namaskar, 45 minutes walk in 24 Surya Namaskar. This is what I generally ask. And if possible, regular meditation. Follow 24th October after 1 month. Patient never had attack in month. She followed diet regularly, reduced her weight by 2.5 kg. Auxiliary measures, same I have continued. I have shifted from Calcarea carb LM1 to LM2. Daily 1 dose empty stomach. So it was a good month for her. She never had an attack. And I have treated her nearly about 2 years. Her father used to visit Sangamner, being a urologist, and that's why he used to collect her medicines many a time. Every time, whenever he used to come, he used to take the medicines for 1 month. And regularly, he has followed nearly about 2 years. He kept regular follow for nearly 2 years. Never had a second attack of pancreatitis afterwards. She received Calcarea carb from LM3 to LM15 in between. Her father was too happy after getting a perfect cure with homeopathy. The question of why LM was used. LM was used because in this case, pathology was advanced. Second important thing, if I would have given the 30, I could not have repeated because in centesimal, you cannot use repetition over there. So it is always better not to repeat too much in centesimal. So it is always better you can very easily repeat in such cases in LM potency. So this was a very good case which taught me a lot regarding the pancreatitis, and basically the person was very happy. He was not expected this from homeopathy, and he literally said he said that it's too much. I'm very much thankful to you. We'll turn towards the next case, which is very important. In fact, this is the daring I have done in this case. A 15 years boy was brought to me on 21st February 21 for the treatment of acute episode of chronic recurrent pancreatitis from Nashik. He was admitted in the hospital for same since 4 days without relief. He was suffering from yellow bilious vomiting with severe nausea, not responding to usual allopathic medication. He lost the appetite completely with severe cutting pain in the abdomen associated with headache. Not past stools since 3 days as he ate nothing. Came directly from the hospital with AMA discharge to Sangame. Since 1 year, he was suffering from similar complaints off and on. He was not able to eat sweets, which causes him headache and vomiting. He lost about 15 kg weight in 1 year, and that was the case. This is the acute episode, and he was not having the strength to sit. When they brought right from Nasik, he was so frustrated. So this was the case. It was necessary to treat him immediately. He was not in a condition to give me a detailed history. So I decided to treat his acute state and afterwards to deal with this with his chronic wound. So what do you can think about? Which remedy you can think about in such types of cases? Any idea? This is too important. This is too important. So these are the rubrics which I have selected. Inflammation pancreas. Second, inflammation acute pancreas. Vomiting headache during. Stomach vomiting bile bilious headache during. Vomiting bile bilious headache sweets after. And this was the repertorization. I have used iris in pancreatitis many times, and iris is a very useful remedy in pancreatitis. One more remedy in chronic case is Calcarea arsenicosa. But this is acute, which I have to handle at that time, and I have decided better to go with iris. So this was wonderful case. Iris versicolor, if you read there, it has direct action on pancreas, thyroid pancreas. It is glandular affection, increases the flow of bile. It is very important remedy for frontal headache with nausea, the stomach vomiting, sour, bloody, biliary, nausea, profuse flow of saliva, like Merck, Ipecac, Caliodide, deficient appetite, abdomen, the cutting pain, flatulent colic, constipation, and Boric has mentioned give 30th. He has given the hint, give the 30th. Hints given by Boric whenever it has been written in between in Materia Medica plays very vital role. I used to use that and I used to experiment on that. In Cilicia, he has said for the corneal opacity, give 30th per month, and I have tried and it worked. Even in Natramur, if there is coryza with dropping of water from tip of the nose, here it mentioned use 30th, and I have tried it many times and it worked. So this was a very good hint by Bori. On 21st February, I have given him a remedy. I asked him to give him very soft diet as dal rice for 2-3 days and iris versicolor 30 CDS for 3 days. I asked them to come after 3 days. It was rather a difficult, dangerous thing to go ahead with this, but I have taken risk because already he had taken the allopathic treatment, he has received the antibiotics, he has received the anti-inflammatory, all those things, all those stuff which he has already consumed. So someone should treat him. I have considered I might. And on the 24th, they brought the patient. Patient never had a vomiting after starting the medicine. He started tolerating the soft diet. His nausea and headache stopped, looking quite fresh as compared to the last consultation. I have asked them that he should avoid all bakery products which he used to like, Chinese food. Start gradually the regular home diet, and I have continued 15 days the same remedy, the iris vertically. And this fellow I have treated later with the chronic remedy. But this was an acute which I want to share with all of you, and that's why I have worked with this remedy. And this is a wonderful remedy. So he was treated as a chronic case, never had a second attack of pancreatitis afterwards. He received, sorry, this was not the, this is last sentence of the, he received the Calcarea Rs. In this case, I have given letter him Calcarea R. And they were so happy after returning that they said that it is not, it was how it can be possible, because we used to last 1 year here, never gone to school because of all those problems. He was not gone to school. He was suffering again and again with severe colic, and it is wonderful result we got with the homeopathy. So these were the cases which shared a lot, which shares knowledge about those remedies. Keep it in your mind. Iris versicolor, never forget, this is the remedy in acute states of pancreatitis. Wonderful remedy. Second important thing which I want to share, Calcarea acetica is also remedy, one more remedy which you can think, and Calcarea arsenicum is also one more remedy in chronic pancreatitis. Never forget those remedies, because they have direct site of action over there on pancreas also. So if you want to learn with the pathological aspect, always make a habit of reading those rubrics. Those rubrics always guides you regarding the thing. Those rubrics always guides you to the site of action of the remedy. And this is very essential when you go ahead with them. So these are the two important cases which I want to share with you, and with a very typical remedy. So thank you very much being there. Those who have not yet joined our Divine School of Homeopathy, be a member of our school. Contact Dr. Prerna. Her number is there, and you can get very nice cases in homeopathy with the help of that and a practical learning. Is there any query we can discuss? We have 5 minutes time. Thank you for everyone, any practitioners, many students who are there for today's session. I'm very happy. Prajakta, thank you. So thanks a lot. Thanks, Hardik. And those who want to learn in such a manner, they can join us and learn like this. So thanks a lot. We'll have a chat if we want, if you have any query, any question regarding this. No doubts? I have many doubts. In fact, I am a person of doubts. Basically, when I used to treat such cases, there are many questions arises in my mind, whether my remedy will work or not, whether it will be a very perfect simillimum or not. But generally, I take much more efforts whenever I used to treat such types of cases. I used to take much more efforts, and unless and until I'm quite sure, I never treat such cases. So this is the way with which you can approach and you can learn a lot. So my suggestion to all of you, learn as much as you can. Learn as much as you can. The day will be there. There will be only homeopathy for better mankind. This is my suggestion to all of you. So thank you, and thank you Divine School of Homeopathy for inviting me for today's session. And today it is not that someone is not there and I am not but I am not a person of what you can say misspirit person. It was first time I was invited for the speaking, being a speaker over there. So we'll meet again whenever time permits. Thank you everyone.
Hello, sir.
Sir, we want your lecture weekly, sir.
I will try my level.
Yes, sir.
But question is that my wife, she says that you do remain over there in your office, don't come home. She says that you make a toilet and every facility over there and don't come home. This is the problem.
We will request madam only, sir.
You met
हाँ
madam.
सर, हम सब रिक्वेस्ट कर देंगे।
सर हम कराची से इंडिया तक हम सब मिलके रिक्वेस्ट कर लेंगे मैम से।
Okay, no problem. I will wait for your request and I will share her number to you.
थैंक यू सर, loads of thanks sir. Thank you so much.
Thank you, sir. Thank you, sir.
Thank you.
इनविटेशन क्या करूँ?